Thank you, and I really want to thank the doctors and my colleagues in government who have joined us on this call and this press conference briefing, as well as the presidents of the medical institutions that I meet with and speak with twice a week to get in every 2 weeks, every 2 weeks, I communicate with them to get an update on exactly what is taking place in the borough and the city around COVID-19. Friday, when I spoke with them, they clearly shared with me that this new Kawasaki-type syndrome is something that is really concerning and is on their radar. Many of us thought that COVID-19 did not have a major impact on our children, but based on what they are seeing, the number of cases, I believe we're up in the area of 173 cases here in New York City with one fatality. When I spoke with my hospitals in Brooklyn, many of them indicated having a number of cases. And this brought a great deal of alarm and concern for those of us who have been on the front line of fighting coronavirus. Coronavirus has clearly become a formidable opponent. It has altered in many ways. It has attempted to attack the human body in so many different ways, and keeping up with the approach is something we must do in real time. And today we are announcing a call for the Department of Education to use the virtual space that they currently use to communicate with students for remote learning. We would like for them to use this same system to update parents weekly or as needed. It is important for parents to know what they should do if their child is experiencing any symptoms that is similar to the Kawasaki-type syndrome, and how to immediately seek necessary care. That typical rash or some form of fever or some form of physical symptoms is something that should not be ignored. And it is imperative that many of the parents that we communicate with in particularly low-income, harder-hit coronavirus areas, they do not watch briefings every day from the president, the governor, and the mayor. They do not read all the papers that produce different data. They receive their communications in different ways. One thing we're clear on is that every student should be interacting with their schools through some form of technology or some form of virtual universe. We want to utilize this method of communication daily as a form of communicating with our not only students, but with the parents as well. Today I communicated with the chancellor. He was extremely open to this concept and idea. We are going to have a briefing with his team tomorrow or early this week. My chief of staff is now currently arranging that. He will update what they are currently doing, and we will look to institute something as important as a communication line using the virtual universe, using remote learning. Remote learning not only can teach children the academics that's involved in education, but it also should be used as a tool to teach parents how to protect their children every day, particularly with a formidable virus such as coronavirus. The structure we believe that could be successful is one, to allow all of the executive superintendents to communicate directly with their superintendents. The superintendents in return will communicate with the principals or the family support coordinators. They are already in existence. The family support coordinators are currently communicating with parents would now want to infuse this information briefing as part of their communication with the parents. By utilizing this structure, it would ensure the integrity of the data that's being handed down to the parents, starting at the level of the executive superintendents. Every district and every borough has an executive superintendent. For example, in the borough of Brooklyn, we have 2 executive superintendents, one in Brooklyn North, one in Brooklyn South. It is almost similar to how the police department has divided up the city to have patrol commands. This is an excellent method of ensuring that communication reaches the grassroots level. Now is a time more than ever to communicate with up-to-date, real-time data to deal with the virus that is impacting our families and now our children in real time. And so again, I want to thank the healthcare professionals that have joined us, as well as my colleagues in government. Councilman Justin Brannon will go into the legislation he's looking to introduce, and my other colleagues in government will also give input on the importance of ensuring real-time communications to our parents. Jonah, thank you very much.
Thank you, Borough President. We are going to hear from some healthcare professionals, some doctors who have been very gracious in joining us. First, we'd like to hear from Dr. Natalie Santiago.
Good afternoon, everyone. Thank you, President Adams, and thank you, Mr. Allen, for inviting me to this forum. I am a board-certified pediatrician in the Chicagoland area, and I've been in practice for nearly 13 years. And so in that time, I have taken care of many children. Thankfully, I have not had any children who have been positive for COVID. However, I've had multiple children whose parents or other caregivers have been positive for COVID. And, you know, most of my patients are in these vulnerable communities. I do work primarily in an underserved area. And so our numbers in these communities are extremely high in the Chicagoland area. And so it is a very real and frightening issue that we're tackling here. And just like you had mentioned, President Adams, one of the biggest things is education. And so many of my families, you're right, they don't listen to our mayor and our governor who give briefs every day, every weekday. Many of my families, they do, however, follow social media. And so a lot of my updates are through social media or through direct calls to my patient families.
Thank you, Dr. Santiago. Next, we'd like to hear from Jason T. Elliston, MD.
Good afternoon. I appreciate everybody's time this afternoon. Thank you, Borough President Mr. Adams. I've heard a lot about you. Thank you very much for inviting me today. I'd like to say, first of all, that I'm a pediatrician at a community health center in Jersey City. I have a background in pediatrics and allergy immunology. And since the beginning of this pandemic, or in the beginning of this pandemic, the census for us in pediatrics was hit very hard. Our census went down quite a bit. And as things progressed, you know, I did have patients that tested positive for the virus. They got the virus from their parents or from other close contacts. So as things progressed, I had more and more patients that did test positive. And then the administration at my health center, they were very active in setting up telehealth. So we got on board with telehealth right away, and that way, even though the patients were not coming in, we were still giving care to the patients by telehealth, and that worked very well. Soon after that, we started hearing reports from the United Kingdom about this Kawasaki-like syndrome, this inflammatory syndrome that were affecting children, and the numbers were up. So we paid attention, and soon after that, my sister-in-law told me about a child in Queens that was the first child to have this syndrome and get admitted to the ICU and, you know, go through a lot of different situations. And then after that, maybe this past Thursday, I received a request for a conference, a telehealth conference, and one of my patients had fever for a few days, very irritable. It's a 3-year-old child. And so we did the telehealth video, and I noticed that the child's eyes, they were red. The child was very cranky. The child was very irritable. The child was febrile at the moment. And the mom also said, you know what, the child also has a rash. And so she showed me the rash via telehealth, and it was a very impressive erythematous or red rash on the shoulder. There's a plaque. And I said, you know what, ma'am, you need to go to the emergency room right away. We need to rule out this inflammatory disorder everybody's talking about. So needless to say, the child was admitted to the ICU for this Kawasaki-like syndrome, and the child has done very well. So that's because of that was because of my attention. Well, it was due to the mother taking steps and the care that the child got. But I want to give credit to, knowing, being open to this and being ready for this, ready for this and being educated around this. And so I think that the child did really well, and the child did not have any organ failures and things like that we see, because the child got care very quickly. The child was admitted to the ICU. The child received the IVIG. The child also received steroids, aspirin, and the child is now in the step-down unit doing very well. So I think that education as far as parents is paramount. It's key. We need to have some sort of platform, as you have been discussing, the remote platforms, where we are reaching out to these families, these children, and saying, hey, if you notice that your child has a fever and it's been going on for a couple of days, don't just say, okay, it's going to just pass. You need to reach out to your doctor. You need to have things to say. If your child looks very sick, if your child's energy level is low, you need to reach out to your doctor. So those are the kind of things that I've been seeing. Those are things that I just wanted to touch upon. And again, thank you for your time this afternoon. Thank you.
Thank you, Doctor, so much. Appreciate it. Next, we'd like to hear from Dr. Leslie Hayes, MD, and then we're going to throw it over to some of our lawmakers and colleagues in government. Dr. Hayes.
Good afternoon, Borough President Adams and Mr. Allen and everyone else who is on the call, the elected officials and politicians. I am Leslie Hayes. I am a board-certified pediatrician as well as a board-certified adolescent medicine specialist. And throughout this COVID-19 pandemic, as an adolescent medicine specialist and a pediatrician, a lot of the care that we have been providing to patients has been through telephonic and telehealth media. And it's been helpful to be able to still do visits, medical visits with our patients, be it via telephone or through the audio as well as visual aids that we use in telehealth. And that platform has allowed us to continue access and delivery of what we consider high quality health care to our patients. By utilizing a media that will give patients an opportunity to learn about this new pediatric multi-system inflammatory syndrome, which it is called, would be an excellent way to allow patients an opportunity to connect with healthcare providers. We talked a little bit about the presentation, the Kawasaki's disease, all of the different manifestations that this particular syndrome presents with. But for parents, it's really important that they know what the initial presentations are. And things like, I think Dr. Gell has already mentioned, fever or rash. If they don't really know that these are the presenting symptoms for this very significant infection, then they'll miss the boat. And I think having the connection between our educational system and our medical system is extremely important. Through adolescent medicine, we actually have done a lot of work within schools delivering healthcare. So having that access through the Department of Education, being able to reach out to parents and give them an opportunity to connect with a medical provider is really, really important. I think we'll need to also look at not only connection via those medias, but also other ways to talk to parents, because even though some of them don't necessarily read the literature or hear about things, they also may not have access to social media and other means as well. But I think that by allowing them various methods to be able to at least have a connection to a medical facility is really, really important. So this need for, I would say, alerting, educating, and connecting our parents and students to healthcare providers is very, very important. Many of them don't, in underserved communities, many of them don't have primary care providers. So at least having a connection to a medical facility, being able to ask questions. We, at my institution, have a hotline developed that parents can call if they have questions, and then we're available to direct them to whatever services they need is very, very important. So yes, giving them means and access to ask questions, directing them through what their questions are and what their concerns are about their children is very, very important. And I think it's something that really needs to take place. Thank you.
Thank you, Dr. Hayes. Before we turn it over to our colleagues in government, Councilmember Brannon, Councilmember Powers, and Councilmember Kalos, I just want to remind the press that you can feel free when we conclude the speaking order to either write your question in the chat if you have any for any of the people who have just spoken, or feel free to unmute yourself. But we're going to go over first to Councilmember Justin Brannon.
Thank you. Thank you so much. Thank you, Borough President, for bringing us together around this important issue. You know, I think it's important for elected officials to zoom out a little bit. I think that we are so close to the flame on this stuff and so tuned in to the daily reports and the data that we get, and that we have the privilege of having the access to, whatever they provide for us, that is. But we have to keep in mind, and we cannot assume that the general public has access to the same frequency of information and granular information that we do. So one of the things I've always believed is that we got to meet people where they're at. We can't try to you know, reinvent the wheel. We have a captive audience in the remote learning program, and we should be utilizing that to make sure that we're getting the right information and the most important information out to folks on a daily basis. Look, I think part of what is so frustrating about this virus, about COVID, and certainly about this new Kawasaki-like syndrome is that we learn something new about it every single day. And I think there'll be a time and a place, certainly, to have a full accounting and an audit of what we knew and when and what we could have done better. But right now, we have an opportunity to make sure that people know what the deal is with this new syndrome that we're seeing. And every day we're learning more. I believe today they said out of the 200 cases that they've seen around the country, 120 of those cases are right here in New York. So once again, we are at the epicenter of whatever this new syndrome is. But right now we're in the very, very early days of this syndrome. So as information develops and as every new day brings some sort of new development in what we're learning and what we're looking for and the symptoms, getting the information directly to the parents and the guardians through the remote learning program, the remote learning system, is the best way to do it. It's a no-brainer. It needs to happen. The city can only call on the Department of Education to do something. City Council doesn't have the power to make the state do anything with the Department of Education. But we are going to introduce a bill at the request of the Borough President calling on the Department of Education to do this. And we hope that that will compel them to just do it on their own, so we don't have to legislate them to do this. But it's a great idea. It's a no-brainer. It's common sense. We need to get information to the parents and guardians, and we need to meet them where they're at. They shouldn't have to go looking for information. They shouldn't have to be relying on what they hear on social media or what they might have overheard at the supermarket. We need to get information to them directly, and this is the best way to do it. So I'm proud to partner with the Borough President on this effort. Thank you.
Thank you, Councilmember. Next up, we're going to hear from Councilmember Keith Powers, followed by Councilmember Kalos, Ben Kalos. Then we're going to throw it back to the Borough President.
Unmute. Thank you. Nice to see everybody, and thank you to all the doctors and everyone who offered their expertise. And it looks like Leslie might be your birthday back there, but based on your background, so happy belated or happy birthday. But thank you to the Borough President and his team for throughout this crisis taking a leadership role in this city, talking about issues that are unidentified and need a voice to them. And this is certainly one of them. We are learning throughout this COVID crisis that it's not just, I mean, it's a tremendous loss of life, and we are saddened as a city. We're learning that there are curveballs to this now as well. And it's been actually through the press that we've learned many of these stories about other effects like this Kawasaki public health crisis we're learning about. We're learning about symptoms in young people that are not going away. We're learning about other issues in our healthcare system, people not going to hospitals because they are afraid of walking into a place where the COVID is, even though they're not tackling a different issue. So these are the types of issues we have to be talking about as we are looking to the future of this city. And I'm really grateful to the Borough President, Councilmember Brannon, and others for elevating this particular issue. And this one, as Councilmember Brannon said, is kind of a no-brainer. We have tablets in the hands of individuals and families throughout this city now. We have a portal by which we can disseminate information, and we are able to quickly and rapidly get information to families in the city. So why not take advantage of that? So I joined the Borough President, I joined my colleagues here in saying this is a fast, easy, and simple way to make sure that families understand what's going on when it comes to public health right now. The one thing I'll add, though, and I think the Borough President's tapping into something, is that in this new world that we have, there is an ability to get information out to families in a new way. And the Department of Education and the technology is that way. And so even as we emerge out of this crisis, when we look to the future, this is going to be the way that we can get information out to people. So I really am grateful to the Borough President for having sort of foresight here to know and understand that this is the way that we're going to be able to get information out in the future, is through our technology with families that don't understand how to use it, and through our Department of Education. So whether it's this immediate crisis that's affecting families or it's what's next, this is going to be the way to do it. And we've learned in this city that we're always a few steps behind this virus. Now it looks like we're talking about getting ahead of it by being ahead in advance and getting information out to families. So this is the type of thinking we need to have right now, is to be thinking ahead and thinking a few steps ahead and thinking about what's available to families right now to help them better be equipped to dealing with a public health issue. So very grateful to the Borough President, his team, for setting this up today, to my colleagues who are thinking a few steps ahead and tackling the issue of the moment. And this is going to continue to be a difficult moment in our city. And I'm grateful for everybody who's leading the way here, whether you're on the front lines or thinking strategically about the issues ahead. So I look forward to working with Councilmember Brannon on his bill and to Borough President and continuing to advance these issues in the city. And thank you to everybody for all your work.
Thank you so much, Councilman Powers. Next, we're going to go to Councilmember Ben Kalos. After that, we'd like to hear a little more from Dr. Santiago, actually, about her experience seeing Kawasaki patients. And then we're going to throw it back to the Borough President briefly, and then we'll open it up to questions. Thank you. Councilman Kalos.
Thank you very much. Thank you to our Borough President from Brooklyn, Eric Adams, for your leadership in bringing us all together today, and for calling on the Department of Education to do this. I'm Councilmember Ben Kalos, and I joined Borough President Eric Adams and fellow lawmakers in calling on the Department of Education to get information about Pediatric Multi-Inflammatory Syndrome to our students and families. We as a city didn't properly assess how quickly coronavirus would grow here. By the time we had a dozen cases, it was too late, and we've seen tens of thousands of deaths. At the outset, it seemed like a miracle that our children weren't getting the disease, that somehow they would be spared. We left our schools and playgrounds open. Late on Thursday afternoon, May 17th, the Centers for Disease Control issued a health alert for multi-inflammatory syndrome in children associated with coronavirus disease 2019. On April 26, 2020, the United Kingdom recognizes these cases. A UK publication found 8 cases, including 1 death. 75% of these children were of Afro-Caribbean descent. As of May 12, 2020, the New York State Department of Health identified 102 patients, including patients from New York City with similar presentations, many of whom tested positive for SARS-CoV-2, infected by the RT-PCR or serological assay. The New York State and New York City continue to receive additional reports of suspected cases. Something that I was shocking to learn from the Borough President was 24% of these cases are Black children, followed by 14% Hispanic, 10% Asian, 9% white. And I just want to say this, anyone can get coronavirus, but it doesn't matter whether you're here in New York City, New York State, or even the United Kingdom. The disease is amplifying the systems of racism that mean our essential workers and those on the front lines are predominantly people of color. We need to do something about that. And as a parent of a 2-year-old, I can tell you, trying to convince a 2-year-old to wear a mask and explain why that is important isn't going to work. Trying to explain social distancing really just means me chasing my daughter around a park or street, trying to keep her 6 feet away from anybody else where she normally might be able to play with other children. We need to use the Department of Education and every single platform, especially the media, to get this message out to parents. They need to know that our children aren't safe, and that as the weather gets better, and as I go around my district and Central Park and different parks throughout the city and see children being allowed to play together because their parents don't think that there's a risk, they need to know, and our children need to know. And we can do it. Tomorrow morning, DOE should get this message out to the children and to their families. We need to get it out to anyone who will listen, that our children are vulnerable, that we need to protect them, and that we need to figure out contingencies for situations where our essential workers, who are predominantly people of color in our Black and brown communities, have their families spared. Because right now we've been asking them to put themselves on the line, and now we're seeing not only are they putting themselves on the line, but they're putting their children on the line, and we need to do better. Thank you, and thank you to Borough President Adams.
Thank you, Councilman Kalos. We appreciate it. We'd like to turn it back over to Dr. Santiago, who, as I mentioned, has actually interacted with patients with Kawasaki, just to offer a little bit of perspective on that. After that, we'll give it back to Borough President Adams for closing remarks, and then we will open it up to questions from the press. So first, Dr. Santiago.
Thank you, Ellen. Am I muted? Let me see. Can you all hear me?
We can hear you, yep.
Okay, great. So yes, I have taken care of children with Kawasaki in residency and in practice. And one of the things that was touched on, I believe by Dr. Hayes, was about being able to, Dr. Hayes and Dr. Elliston, was about being able to recognize the symptoms. So of course the symptoms are fever, usually about 104 or greater for at least 5 days. And then you need 4 of 5 criteria. So the criteria are rash, redness of the eyes, usually without discharge, swollen lymph nodes in the neck, usually just on one side, oral changes that can be cracking and redness of the lips, or a bright red tongue, which we call a strawberry tongue, and then changes of the hands and feet, so redness, swelling, peeling around the nails. One of the interesting things about the most recent patient I had with Kawasaki, not during this era of COVID, was that this child presented with symptoms and they were very spaced out. And so us as medical professionals would really have to be diligent in recognizing that this could be a possible sign of the multi-system inflammatory syndrome. But this child had fever and sore throat. Sore throat was just incidental. He is a strep carrier. And so he tested positive for strep. I treated for strep, but it still didn't quite look right to me. So I had mom bringing him back. Thankfully, mom lived nearby the health center, so she was able to come back. Transportation was not an issue, thankfully. And over the next maybe 4 days, he started to exhibit these symptoms. And, thankfully, I was able to catch it in time and advise mother to take him to the nearest children's hospital for treatment. And so he was admitted. As Dr. Elliston mentioned, the treatment is IVIG, immune globulin, and of course aspirin, because Kawasaki in and of itself can affect the arteries. And so it can cause clotting, which can lead to cardiac arrest. And the aspirin and the IVIG help to treat that. Now with the multi-system inflammatory syndrome, it leads to multi-system failure. So it's a little bit more similar, as I understand, to toxic shock syndrome, in which you can go into septic shock, meaning your organs will start to shut down due to infection. And so we definitely do have to be very diligent, get the word out. My health center has also switched over to a telehealth platform. And so any child, if their parent is calling and they have a concern about a rash, that needs to go from being a telephone visit to an actual virtual visit, either through FaceTime or Doximity or through Zoom, in order to be able to properly assess these children. As I understand, many of the children with multi-system inflammatory syndrome, if it's caught, of course, in time, they're admitted to the ICU, they're treated, they often do very well. But it is extremely important that we catch it, that we get the word out to our families in any way that we can. And I think what you all are doing in New York, I mean, this plan sounds awesome. I wish that we had it here. I do go through my virtual visit list for the day, anything. It can be the parent is calling because of eczema. They need an eczema cream refill. Well, that visit is going to be addressing also the symptoms of COVID and multi-system inflammatory disease for the children, and making sure that the parents understand the importance of protecting themselves and their children with hand washing, social distancing, et cetera, et cetera.
Thank you, Dr. Santiago. We're going to turn it over to Borough President Adams to offer some closing remarks. Then we will open it up to questions from the press. As a reminder, you can write your questions in the chat and I can read them aloud, or you can just unmute yourself and ask one of the participants directly. Thank you.
Thank our healthcare professionals, doctors, as well as my colleagues in government. And I just want to make 3 quick notes. One, it was important that we receive information from our healthcare professionals across the country, Chicago, New Jersey, and New York. The second thing is, if you look at who's engaged in the conversation and how we address the COVID-19, you notice the lack of diversity. You don't see Black and brown people at any of the tables with the president outside of the Surgeon General. You don't see him on the national, the statewide level, and you don't see him on the citywide level. Many of the issues that are impacting Black and brown communities, these frontline medical professionals, they see it firsthand. We need to start asking them to be part of how do we address these issues on the front line. Their voices not being present is not allowing the voiceless to be heard and receive the proper treatment. The third is telemedicine. You've heard all 3 doctors talk about the power of telemedicine, something that we stated when COVID-19 first came to New York. Our city and our state and our federal government was far too slow in rolling it out in a capacity that it should have been rolled out in. We need to ensure that we have an aggressive telemedicine campaign, particularly now when parents can actually show some of the visual signs that a child is going through, and a phone call is just not going to get it. Having access to technology, iPads, and other form of visual technology is no longer a luxury. It is an option. It's no longer an option. It is part of the necessity of survival in any form of a post-COVID-19 situation. This is our new norm, and having access to technology and being able to communicate with your doctors cannot be part of the affluent. It must be part of the entire country that we are a part of. Let's be clear. COVID-19 is a formidable adversary that took both extremes of our society. It devastated the lives of our family members in nursing homes. We should not allow it to devastate the lives of our children in nursery schools. We must be ahead of this. And the only way we can do so is, number one, to give the power to our healthcare professionals and resources. Two, to give parents the education they need. And three, for government to be part of dissemination of that education in real time and the methods that parents utilize every day on all platforms. That is how we're going to accomplish this task. We cannot leave any families behind. We started out leaving families behind. We cannot end up leaving families behind. Thank you very much, Jonah.
Thank you, Borough President. At this time, if you have a question from the press, you're welcome to unmute yourself or write in the chat and let us know who you'd like to answer your question. Thank you.
Yeah, hi, this is Roger Stern at 1010 Winds. I have a question for the Borough President. Under this plan, how would you conceive it working, that before classes start, there would be this advisory to parents? And what do you do with older students who are able to log on to online classes on their own and wouldn't have parents necessarily with them? How do you make sure in those cases the message gets to parents?
My conversation today with the Chancellor and someone from the Department of Education, we're clearly going to iron out the actual implementation. But ideally, if we identify one day a week where parents know what time they will receive this PSA or this briefing, it allows the parents to gauge this around their time, and really Zoom, WebEx, all of these items can be on one's cell phone or other devices. And so we will have a clear time when parents know this information is going to be readily available. And under emergency situations, it can be done and carried out prior to class time or immediately after class time.
Thank you.
Could we perhaps get a word or two from Councilmember Brannon as well, since he is introducing the bill?
Sure. Yeah. I mean, look, I think anytime we do something like this with the Department of Education, we sort of introduce a bill as a threat, right? Like, we don't want to have to legislate them to do something like this. We want to compel them to do it on their own. We want them to see that the Borough President's idea makes sense and that it's something that needs to be implemented. And frankly, it can't wait for the legislative process. It should happen tomorrow. With something like this, where news is breaking so quickly and information is developing faster than you can imagine, the glacial pace of legislation just doesn't work with a novel virus and this new symptom that we're dealing with in children. So we're hoping that the Department of Education will see that this is a great idea that does not require legislation, but we are working on drafting legislation that would force their hand if need be.
And I understand that Dr. Hayes wants to add something quickly as well.
I'd like to also piggyback on what the Borough President mentioned in response to Mr. Stern's question. As an adolescent medicine specialist, I primarily take care of teenagers. So in doing telehealth visits with them, frequently their parents are somewhere around. So the message, when it is being delivered, basically just needs to include reminding them to share the information with their parents. And at that age, them knowing the symptoms themselves is also very helpful, so that they can be able to identify what's going on with their bodies as well. So that's just what I wanted to add. Thank you.
Thank you, Dr. Hayes. Any other questions for the Borough President or anyone who's spoken in the press? Okay, seeing none, we want to thank everyone again for their time today and for participating in this important conversation. As a couple of housekeeping items, a press release with a recording of this press conference will be made available shortly. If you have any follow-up questions, you are welcome to email me. My email is jonah.allon@brooklynbp.nyc.gov. So thank you again all for joining.